Is Zepbound linked to sexual dysfunction? That's a question a lot of people have when starting this medication, and it's absolutely worth taking seriously. Before we dive in, this video is for educational purposes only and isn't a substitute for medical advice. Always talk to your healthcare provider about your medications and any symptoms you're experiencing. So, what is Zepbound? It's an FDA-approved medication for chronic weight management, also known by its generic name tirzepatide. It works through a dual mechanism targeting both GIP and GLP-1 receptors, which helps reduce appetite, slow digestion, and support weight loss when combined with diet and exercise changes. Now, the big question, based on current FDA labeling and clinical trial data, Zepbound does not have an established direct link to sexual dysfunction. In clinical trials involving over 5,000 participants, sexual dysfunction was not identified as a significant adverse event. The most commonly reported side effects were gastrointestinal, things like nausea, diarrhea, vomiting, and constipation. That said, this topic is more nuanced than a simple yes or no, and here's why. Obesity itself is strongly associated with sexual dysfunction. It can affect hormone levels, cardiovascular health, and psychological well-being, all of which play a role in sexual function. So if someone notices changes in their sexual health while on Zepbound, the medication may not be the cause. In some cases, as metabolic health improves with treatment, sexual function may actually shift in a positive direction, but everyone's experience is different, and multiple factors can be at play at the same time. It's also worth noting that sexual function wasn't a primary endpoint in many of these trials, so rare effects could potentially be underreported. If you notice anything that concerns you, that's exactly why your healthcare provider is the right person to talk to. There's also one important contraception note directly from FDA labeling. Per the FDA, Zepbound may reduce the effectiveness of oral contraceptives. If you're on the pill, FDA labeling recommends using a non-oral or barrier method of contraception for 4 weeks after starting Zepbound and after each increase in your Zepbound dose. Talk to your prescriber about the best option for your specific situation. If you do notice any changes in sexual health while taking Zepbound, bring it up with your healthcare provider. Don't assume it's definitely the medication, and don't dismiss it either. A thorough evaluation can help identify whether it's related to the medication, underlying health conditions, hormonal shifts, or something else entirely. Your doctor can look at the full picture, and as always, never adjust your dose or stop taking your medication without speaking to your doctor first. Quick recap. Zepbound is not currently linked to sexual dysfunction based on clinical trial data and FDA labeling. Obesity itself can contribute to sexual health changes, so context matters, and if anything concerns you, your healthcare provider is the right person to talk to, not a forum, not a search engine. Have questions about Zepbound or other weight management medications? Drop them in the comments. We'd love to cover what's on your mind, and if this was helpful, give it a like and subscribe so you don't miss future videos from Fella Health.